Hello, I am Pamela Hicks, Quality Improvement Specialist at the Carolina Center for Medical Excellence, also known as CCME. Today's webinar, Patient-Centered Communication, Active Listening for Improving Outcomes, is sponsored by CCME. CCME is a partner in the Health Quality Innovation Network, known as HQIN, a quality improvement organization servicing Kansas, Missouri, South Carolina, and Virginia. The goal of this webinar is to outline patient-centered communication as an important provider competency that leads to better patient engagement and improves outcomes. With so many competing priorities in healthcare right now, why should we invest time and effort into developing better patient-centered communication skills? Research evidence indicates there are strong positive relationships between a team member's communication skills and a patient's capacity to follow through with medication recommendations, self-manage a chronic medical condition, and adopt preventive health behaviors. Improvements in diagnostic accuracy, quality of care, and patient adherence leads to improved outcomes. An improvement in clinical quality measure data is also realized, which leads to better outcome payments. Other positive changes are reduced patient anxiety and stress, reduction in healthcare costs, ED visits, and hospital admissions. Medication errors and malpractice risk have also been reduced. Before we get into the specifics about patient-centered communication, it's important to understand the concept of patient-centeredness. I really like this statement from the National Health Council. Patient-centered healthcare is care that is respectful of and responsive to individual patient preferences, their needs and values in context of their own social worlds. Patient-centeredness is created by engaging, informing, and actively listening to people with chronic conditions at every point of contact, from the research bench to the bedside and everywhere in between. Patient-centered communication acknowledges the whole person, their personality, their life history, and their social structure in order to develop a shared understanding of the problem, treatment goals, and barriers. Let's look at examples of verbal methods for facilitating patient-centered communication. Rather than asking a yes or no question, such as, "Is this the worst headache you've ever had?" you might say, "Tell me more about the pain you are experiencing." Make statements that show understanding and foster the patient's own ideas. When the patient has finished speaking, a great way to rephrase what the patient has shared is to say, "Let me summarize what you've told me so far." To ensure the patient has a clear understanding, ask them to then summarize what you have discussed so far. Nonverbal methods of communication, such as eye contact, leaning forward as the patient speaks, head nodding, and appropriate facial expressions also indicate active listening. A great way to elicit the patient's agenda is with open-ended questions. A few suggested phrases are outlined here, along with the area of focus. After asking an open-ended question, practice the pause and allow the patient to fully respond without interruption. If the patient is interrupted, they may choose to shut down and resist sharing. Active listening is a conscious effort that requires empathy, effort, and attention. It requires time and capacity to truly listen to your patients, hear their stories, and learn what matters to them. Adding active listening skills to the medical toolbox complements best practice guidelines by addressing the patient's fear, grief over a diagnosis, practical issues, of access to care, and reliability of their own social support system. Along with eliciting the patient's agenda, actively listening to them, we need to express empathy. Empathy is the capacity to understand and relate to the patient's illness experience and their emotions. Simple statements such as, "I can see that this makes you feel very vulnerable," show that we truly care. Our responses when a patient shares intimate details are very important. Listening with an unresponsive, blank expression may very well block the patient's emotions. Let's take a look at a real patient's experience. A 70-year-old male, newly diagnosed with stage 3 CKD, has a new patient appointment. He is clammed up, he's frustrated and weary with yet another diagnosis, another specialist added to his plate. The nephrologist senses his resistance to share as he tells her, "You can just get what you need out of my chart." She leans in and asks the patient, "Well, what do you want to get out of today's visit?" The patient's response is, "I want to know what I can do to feel better." By asking the question, "What would you say is worrying you the most?" she was able to learn that he did not want to go on dialysis like his mother did. By being attentive and respectful, non-judgmental, and by showing empathy with statements like, "This has to be very difficult for you," the provider gained the patient's respect and trust. She was able to share medical knowledge and treatment options that lined up with his values, his priorities. During the appointment, the patient and the provider then created a care plan, which he was given before leaving the appointment. To ease the patient's concerns about getting so many different labs drawn and x-rays ordered from different doctors, the nephrologist assured him that she would coordinate his labs and imaging orders with his PCP and his other specialists. Now, this is just one patient's experience that was improved by actively listening and enhanced communication skills. Could becoming more conscious, engaged, and active listeners actually improve your patient's outcomes? Here's an idea for a quality improvement activity. Evaluate your clinical quality data and then identify an area of improvement. You might want to target a specific subset of patients and begin practicing active listening. Set an improvement goal, then determine a remeasure period. Another thing you could do is to gather patient feedback by having the targeted group complete a short patient survey with questions relating to communication, adherence, and patient satisfaction with the provider and care team before active listening and then after the remeasure period. Then you can do a comparison. I have included a few resource links that may be beneficial to you. There are a couple of short videos that I found to be very informative. So you can take a look at those if you'd like. I want to thank you so much for joining us today. And please feel free to reach out, contact me using the email listed here for any further information or assistance you might need. Would you like to connect with us? Please feel free to look us up on social media. Thank you and have a great day.